I think that the question of will you see a million or 10 million in Bitcoin clearly has two components to it. One is how fast does Bitcoin get there and how long do you
Hmm.
live, right? And
Yep.
I think unfortunately, our medicals, what I call the medical industrial complex is primarily driven by you being sick. That's where they make their money. If you're staying home and you're not going to the hospital and you're not taking medications, then there's no money in you in the medical industrial complex. And I'm not saying that the doctors out there, the most of the doctors that I've met know don't want you sick, but I think that the systems around them unfortunately promote sickness instead of health. You have the chief educator for the American Diabetes Association coming out and saying that this super high carb loaded meal is good for you as a diabetic. And anybody with any sense can look at that and say, how ridiculous is this and how disgusting is this to say something like that to somebody with diabetes, right? I mean, it's appalling to me. And so people, when they think about healthcare, they think it's super complex. And I say, I don't, as a Bitcoiner, it doesn't feel complex to me because as Bitcoiners, we know it's all about incentives. And so you've got the buyers of healthcare, these health insurance companies who are incentivized by profit, who actually make more money if the costs of services and the utilization of services go up. I can explain that in a minute. But then the sellers of healthcare are these big hospital systems. They clearly want the price to go up. They want to maximize their profit. And so, let me talk about the buyers again, the health insurance plans, because people don't understand this, that if your premium for your family is $1,000, the maximum that they can profit per the Affordable Care Act is $150. So how do they see their profits increase? Well, 10%, let's say it goes to $165. Well, your premium has to go from $1,000 to $1,100. So your premium has to go up for them to make more money. And so, you have the buyers, the health insurance plans, they want the premiums to go up. They want prices to go up over time. You have the sellers, these hospital systems, they want the price to go up over time. So you have the buyers and the sellers of healthcare both wanting the price to go up. And so what's going to happen? You don't need Safedine to understand this. The price is going up. And because there's no market forces that are pressing the prices down. Because in essence, when I go to the hospital, I'm not paying for it. The insurance company is paying for it. And so I'm basically shopping with somebody else's credit card. And therefore, there's really no desire for me to care about what the price is or to care about what I get at the hospital. It's like, give me everything. I'm not paying for it, right? And so that's the problem we have with our healthcare system right now, is that there's no market forces that are working against this. And that's why we're in the debacle that we're in with both Medicare and with these commercial health plans. So that's the thing that we're trying to change, is actually create market forces within the healthcare system. We're at $5.6 trillion right now. If the United States healthcare system were a country, it would be the fourth largest GDP in the world
Jeez.
after the United States, China, Japan. And I think it's catching up to Japan. And so, that's a problem. It's 20% of
Yeah.
GDP. One out of every $5 that we spend goes to healthcare. It's egregious. And so that's what we're trying to change. Our members are paying about 50% of what UnitedHealthcare would pay for the exact same service, because they're
Wow.
going and they're decentralizing, right? They're ripping out all the middlemen. They're paying the doctor directly. And as a result, they're getting a way better price. So imagine ripping $2.8 trillion out of the economy. And politicians don't want that, because then GDP goes down by making this more efficient. And so you've got the politicians, you get the hospitals, you have the insurance companies, you have the pharmaceutical companies. Clearly, they make more money when you're sick, all being okay with the system as is. And it's us as the citizens who are seeing the ramifications of it. And so that in 3 minutes is basically what's wrong with our healthcare system.
It's so wild. There's a lot of doctors that are having issues or leaving, or especially over the last handful of years since COVID. They are, because they're getting squeezed because of this. And this is another thing too. I just heard the other day of, when you go in and as soon as you say I have insurance, then they basically can't. There's like, okay, well, here you go. Now you have to pay the high cost. The doctor gets a little bit, and then the insurance company gets the huge spread basically between the cost of the actual medicine or whatever. Is that where you guys are seeing as well, where that traditional system is just squeezing everyone
Yeah.
basically, and doctors?
Only 8%, only 8% of costs in healthcare are the doctors.
Wow.
8%. So the
Jeez.
people who are supposed to be taking care of us are only getting 8 cents on the dollar. And so what we're seeing, and this is the scary part for people who have insurance, maybe not scary this year, but over the next 5 to 10 years, this is going to be very scary, is all the good doctors are saying,
Yes.
screw this. I'm out.
Yep.
I'm not taking insurance anymore. I'm tired of not getting paid what I'm worth. I'm tired of getting told by the insurance plan what I can and can't do. And so they're going cash pay only. And this is not just the primary care doctors. It's specialists, it's cardiologists, it's orthopedic surgeons, it's cardiologists. Like, these are the people that we want to be in our system to take care of us. And they're exiting. They're just like, I'm out. I'm going to accept cash only. And if you want to come to me, you got to pay in cash. And so not only does that hurt the people who can't pay in cash, because the people making $50,000 a year is not going to be able to pay $15,000 for a knee replacement. Like, they just don't have the money to do that. So it's the rich now get access to this, but the poor don't. So the bifurcation of rich and poor will continue and get worse and worse and worse. But if you have health insurance, you're not going to have access to the best doctors in the world. And so, with Crowd Health, we enable you to go and pay your doctor directly in cash or credit card or eventually Bitcoin, I hope. And they're going to give you great prices. They're going to be the best surgeons in the world. They're going to be the best doctors in the world. And they will only be cash pay. I mean, that's ultimately what's going to happen. And we're seeing it. We're seeing it now. Like, this is not some pie in the sky type of idea. Like, it is happening right now as we speak, that people are exiting the system because they're just tired of it. They're tired of it. There was a study like 6 months ago, maybe it was 9 months ago by now. Doctors spend somewhere between 16 and 18 hours a week fighting with health insurance plans to get paid. Imagine like in your job, like fighting with your employer for 2 days a week just to get paid. What does that mean? That means that they can't spend that time with patients, like in care. Like, I think doctors at their heart, most of them, not all of them, but most, want to like care for their patients. They're skilled at what they do and they want to help people. And they can't do that for 16 or 18 hours a week because they have to fight with health insurance plans. Now, like, change the dynamic where the doctor has to spend zero time on billing. You show up with a credit card or your Bitcoin wallet or whatever and pay them immediately. They're like, I want you, right? Because I don't now have to go and take care of an insurance company. And the best part of that is now it's between me and the doctor. Like, the doctor works for me now. The doctor, I say, and I've said it before, like, you work for whoever pays you. These doctors are getting paid by health insurance companies. And so they work for the insurance companies. They don't work for you, the patient. But if you start paying them directly, now they work for you. It's between you and your doctor. You can decide what you want to do with your body. Like, that to me is one of probably the biggest things that I learned over the last 5 years running Crowd Health is once you take out all the middlemen, all the rent seekers in this process, care gets better. You get better healthcare. Because it's between you and your doctor. That's the magic, the magic
So
pill.
simple.
Maybe magic pill people. I don't know. That's the huge differentiator.
If you like that clip, then you definitely got to check out this next spicy clip. I think you're really going to like it. Come on, check it out. But if you want the full version, the full interview, then check that out over here. Come on, do it. See you in there.